Hello, everyone. Welcome.
Good morning.
Nice to see you guys all on. Thank you for joining. We are going to get started actually. While we are, I'm doing these opening slides, go ahead and put into the chat who you are, where you're from, your state, your facility, things like that, because we always like to see who's joining. Today's topic is going to be our infection prevention resources that we have, all things related to. I'm going to touch on a few other ones, so it'll also cover just some other Telligen resources. I'm Kristen Ives. I'm a quality improvement facilitator here. And we have these sessions every Tuesdays and Thursdays, and we have a few more that are coming up. I will share with you guys the titles of those towards the end. So make sure you join. Not too late for additional people that you know to join these as well. Today I'm going to kind of switch to some live demo. And while I'm doing that, I want you guys to know that, my sessions especially are really casual. So if you guys want to jump in, say something, ask a question, please feel free to unmute, interrupt, because, it's better when we hear more voices. So if you have anything you want to add, or if you want to stop me and go back, or have me look at something in particular, by all means do. I'm going to put links into chat while we go along. This is the Telligen QIN-QIO website. And so this is a good one to bookmark. This is where all the resources I'm going to show you today live. And so you want to make sure that you have this one saved somewhere. Okay, so I'm going to kind of go through some of the resources that are kind of most popular, how about we say, ones that we find a lot of people use. The first one, if you go across the top banner here, there is a tab for resources. This is where I'm finding most of the items today. If you go to resources and then drop down, there is a tab that says long-term care NHSN resources. This is one that's near and dear to my heart, as this is my area of expertise. But this is all sorts of NHSN resources. So you can change your email address. I know a lot of facilities are getting bought and sold these days. So this one might come in handy. This is a reporting roles worksheet, changing the NHSN admin role. Then there is how to add a new user. This also covers how to disable users that have left. So that's helpful. This is a tutorial video that you can watch. And then this is the influenza vaccination reporting. So that deadline is going to be coming up in May 15th. The flu season, as you all know, ends March 31st. So you're going to want to use these two tools to make sure that you get that required reporting in. Also, it has a link to the CDC webpage for NHSN reporting for long-term care. That's important. And then the link to the CMS public data site. Currently, they haven't updated that data for a little bit, but it's still good to know that they do have some of the data public. This is a good one to have bookmarked for anybody in your building who has NHSN reporting. Okay, going back, I am going to go to the resources tab and go to infection prevention and control resources. Again, if you guys want to follow along with me, you can just go to that main link that I put into chat earlier. Let's see, I'll put it in again. If you go to this link, you can follow along with me. Okay, so I am going to next go to the Infection Prevention and Control Resources tab. This web page has a lot of different really great tools. The first one at the very top is the Audit Tracking Tool Workbook. Now, this is great. This is a tool that we helped create that basically anything that you audit in your facility, you can use this tracking tool. And what you do is you fill in the questions that you want to ask during audit. Ask yourself usually if you're doing kind of a secret audit. You put in your questions, and then when you audit, you answer each of those questions. And it really breaks it down for you. It breaks it down and shows you graphs as well. So it will create representations of the data that you collect. This is just, it's a really great tool for your audits. So if you guys are thinking about doing audits, have been doing audits, but you're just kind of collecting numbers and not really doing a whole lot with the data, or don't feel like you have anything actionable after you do your audits, this is a tool that could help with that. So this is a really great one. Also wanted to point out on this one, the nursing home infection prevention rounding tool. If we have ever worked with you on one of the CMS referrals, we may have mentioned this, or maybe we've done one of these with you. This is when we do a sort of in-person or virtual tour of your facility and look at all things infection prevention throughout your building, ask you a bunch of questions. This is that tool. And so you guys can use this for yourselves if you want to. You can print this out, do this maybe, quarterly, something like that, and walk around and ask these questions to yourself and make sure that you have everything in place. So this is another really great one. Another tool on here to point out is the infection prevention orientation checklist. Many times we have found that new IPs are being put in that position who don't have a ton of experience with it. So they're not even sure what to know, what they're not doing, things like that. So sometimes it's helpful to have maybe a sheet to start with. Obviously, it depends on each individual building on what your roles and responsibilities are. So by all means, this is not, a mandate of any sort. But sometimes it's a helpful one to find out, do I kind of have a handle on this role, or things that maybe I should be looking at as an IP. So another really helpful one. As you can see, lots of other topics here. So make sure that you explore it. See if anything here is helpful for you. We have QI tools down here as well. And then also another thing to point out is we have some signage that you guys can use. These are free for you guys to print out and put around your building. So if you ever feel like our signs are faded and crinkled and have water spots on them, or whatever, you can always come here and print these out. We have a hand washing reminder, the steps for hand washing. We have 5 moments for hand hygiene. And then we also have an visitor signage poster, so to speak. So these are all great ones that you can print and use if you'd like to. This one's also available in Spanish if you need that as well. So any of these resources you can just come and pluck. That's what's great about our website, is it's really easy to access. It's just a typical website. You can bookmark any of these things and just use them as you desire. The next page I'm going to go to, if we go to resources again, and we go down to the very bottom to the Vax Hub. So this one has a lot of different vaccine resources. And at the very top of it, of course, by all means, you can explore the rest of this page. A few things, just to give you a disclaimer, could be a little bit out of date. We've even put a disclaimer on here that some of these things might be a little bit outdated. But if you go to the very top, there is the Adult Vaccine Toolkit. And this one is a really great resource. Let's see, click on the access to the resource right here. And what it does is it takes you to this page. And I'll put this one in the chat for you. So this is the vaccine toolkit. And so right here is a great section, because this is kind of the table of contents for this toolkit. So when you click on any of these sections, it'll take you to that part of the page. So that's a little helpful. Otherwise, it's a pretty long document to scroll through with a lot of information. So a couple things I wanted to point out here. Obviously, there are some great resources on why people should get vaccinated, addressing vaccine hesitancy, things like that. Down here is vaccine-specific resources, which is really nice because it really splits it out into each individual vaccine. It gives you links to the recommendations, the information, the clinical information about each of the vaccines, things like that. So this one is a really helpful one if you need to look that information up for whatever vaccine you're discussing, looking at, planning to give, need education on, things like that. Okay. Another section, I'm going to scroll back up to the top actually, just so I can jump down to the right one, is the systems management billing section. So this one can be helpful. There's a few of these links here that are pertinent to long-term care or relevant to long-term care. This one, billing Medicare for respiratory vaccines. This one, Medicare billing for respiratory vaccines and long-term care. That's another good one. And then this one on the bottom, skilled nursing facility and pharmacy billing. So if anybody at your facility needs a little bit of help with some of that, then these are the three resources that you want to look at. Okay. Megan, okay. I was actually just asking Megan, who's our pharmacist, and she said at the very top there is also a PDF with nursing home specific resources. So Megan, I don't know if you want to come off of chat. Was it in the systems
Actually,
management billing?
all the way up. So we kind of struggled where to put it, but right under the title there, yes. So
Okay.
that's nursing home infection prevention and control, and that was compiled, I think, by CMS for us. So that has a lot of good resources as well.
Okay, great. Yeah, and it looks like they also have some billing stuff and data dashboards, and this is kind of a pretty good resource linked within there. So thank you for sharing that. I didn't know that that one was there, but it's right at the top in this blue section.
Yeah, and then I'll just also note that some of the links are not working right now, but most of them are still working and useful, and some of them reroute to as the CDC moves pages around. So I did my best to keep it as up to date, but the information itself, the content, is up to date. So as long as the link's working, you can trust it and use it.
Okay, yes, wonderful. Things are always changing, and so it's hard to keep these resources perfect, but we do try. Okay, and then I also wanted to show you guys, if we go back to the top on this toolbar, that we have podcasts, on-demand learning. So those are both really helpful if you guys ever want to check those out as well. And then we have health equity resources. Shout out to our colleague Ro, who helps champion this topic. So that's another great one to look at. And then we also have the resource library. So this one's a really good one in case you're thinking, I need something, but I'm not exactly sure what, or I'm not quite sure, what page it might live on. You can always come to the resource library and do a search. So right here at the top of this has a search bar. And so you can put in things like workbook. So let's try this one. When it comes up with resources, you can see that we have another link to that audit tracking tool workbook that I had mentioned earlier. So that's another way you can access that. We also have our quality improvement workbook. This one's a really good one. If you are doing anything with quality improvement, it kind of walks you through steps. It gives you some templates and forms that you can use for different parts of the process. So like a root cause analysis or a plan, do, study, act. It has kind of worksheets for those in there. So this is another really good one if you ever want to bookmark that, because that can apply to anything that you're working on. So this is another really good one. I know this is a very common topic. It's not really necessarily related to infection prevention, but we all seem to work on falls. And so, you can go to the resource library and put in falls. We have a fall tracking tool, and we have a fall intervention checklist. So you can always look at both of those. This tool can be really helpful because it's a Excel spreadsheet tool where you can track falls. And again, it kind of creates some graphs and shows you some patterns. Another one that you could put in is maybe you're going to look at your high-risk medications. So you can type in high risk, and it's going to pull up a bunch of different resources related to adverse drug events, opioids, how those things maybe can relate to readmissions. And so we also did a high-risk medication echo series, and this was a really great multi-part series that has a lot of resources, and all the sessions are recorded, so they're on here. So that's another one that you could kind of do at your own on your own time. Just review those and use those resources for this one. So this is another good one to look at. Again, let's see if I can get it up here. Audits can be helpful. So if you put in audit, it will show you or pull up audit, obviously the audit tracking tool workbook, but then we also did some great events, recorded events, the nursing home quality essentials on auditing. So you could rewatch some of those as well. We have a PPE audit tool, things like that. So whatever you're doing in your facility in terms of quality improvement or topics that you're trying to work on, try putting it into this resource library. Another one you could put in is a tool. Say there's a, you want to see what kind of tools we have that you can use. Maybe you need help with your 5-star. So we have a 5-star quality measure rating calculation tool. That can be another really helpful one if you're looking to improve your 5-star rating. So make sure you check out our resource library and see the breadth of everything that we offer. All of these are no cost. Everything on this website, there's nothing you really have to register for. You don't have to pay for anything. There's nothing, no, hoops you have to jump through to use these resources. So we definitely want you to take advantage. While we're here, I don't know if any of my colleagues had any additional resources they wanted to call out, because I'm happy to navigate and show those. Also, to all of those of you who are on, and there are probably 50 or so people on today, have you guys used any of these? Have you found any of these really helpful? Are there any that you want to know exist? I tell people all the time, if you feel like there's a tool that you really wished existed, reach out to us, because sometimes we have one, sometimes we know of one, sometimes we ask other nursing homes whether they have one. So we're always happy to help connect you to whatever you need and whatever might make your life a little bit easier. So please, if you don't mind, you can go come off mute if you want to. My colleague Mickey, she says QAPI tools, resources, PIP templates, PDSA. So again, those are really great things that you could put into here as well, into the resource library search feature, or you can find most of those resources in that QI workbook that Ro had posted, the link right above Mickey's. Those resources generally are in that workbook, because that workbook is supposed to be all-encompassing for anything QI. Okay, and my colleague Gina, she also mentioned the learning management system. So if you go to the resources tab, there is on-demand learning. Let's see, it's thinking. And this is where you can find and access the on-demand trainings. And Gina, I don't know, is this where you wanted me to show?
Yeah, if you can just show them, there's on there like a topic list. So we have root cause analysis and PDSA recordings that people may be able to use in their own time at the facilities too, which can certainly help them in all of these vaccine efforts, infection control program efforts, and any other quality measure.
Perfect, yes, and this one does, these on-demand trainings do require a login to our portal. So if you log in, then you'll have access to those topics. So this one does have a login.
If you do the drop down to the FAQs, what trainings are available, it'll list those trainings.
Perfect. So this one shows that we have health equity. We have a MOST training, so the medical orders for scope of treatment. And then we have a nursing home immunization escape room, Plan, Do, Study, Act, fall management, which is another good one, QI for erroneous schizophrenia coding, and then root cause analysis training. And those are ones that, you know, anybody in your building can take these trainings on demand whenever they have time. I know it's important to be flexible with some of this education. Okay, and then I see Rhonda, you have a question about vaccine assistance. And I don't know if you're able to come off mute, but would love to hear what kind of assistance you were looking for. Are you looking for like a clinic, like a pharmacy partner? Are you looking for education about the vaccine? What? You can also put it into chat. We're all watching chat. That's okay, Rhonda. I know sometimes it's hard to have your audio and make sure your microphone is set up. Mainly help with COVID. So again, I would probably refer you back to either the Vax Hub has some resources for that, but at the very top of that, it also has the adult vaccine toolkit. And when you go to the toolkit, it takes you here, and this is a lot of resources on, you know, if you need just talking points, why get vaccinated, there is a link for COVID-19. Some resources are linked here. Then also, if you have hesitancy, there's different ways that you can help improve that. So there's a lot of resources here. If you do need help with obtaining a pharmacy partner, Rhonda, my colleague Ro just asked you that question. Please let us know, because we potentially could help facilitate that as well. I hope that answered your question, but please put it into chat if it did not, because I'm happy to narrow it down for you. Anybody else? Anybody who's on have any additional thoughts, things that they wish existed, things that they've used from Telligen that they liked? Would love to hear from you guys.
And Kristen, while they're thinking about what they need help with, there's also a couple of COVID-specific documents for vaccine hesitancy. So in that vaccine hesitancy section, the talking points, the vaccine hesitancy talking points is specifically focused on COVID-19 vaccine. That flyer will come up. And then in the COVID vaccine specific resources, there's a little flyer that is written to a language where it could be passed out to residents or caregivers as well. And so we have a couple COVID specific educational flyers available. Okay,
perfect. Yeah, like the frequently asked questions, or here's one for vaccine hesitancy for COVID-19. That's great. And Rhonda, thank you for clarifying a little bit more. We have your contact info, so as Ro mentioned, we can reach out to you and further dig into that with you. It's definitely worth having a side conversation and seeing how we can help and connect you. Anything else in terms of resources? We have a lot of different things on here, so by all means, bookmark the Telligen page and take a look at what we have. Most of our events that we've held over the years are recorded and put on this website. So make sure that you, when you're looking through the resources, sometimes the resource library might be the easiest place to find those. We also have a link to them on the events page. So if you go to the events tab at the top, there are past events. So sometimes they're linked there as well. Typically the event page is a really helpful one if you want to see what's coming up. We update these titles to have the different topics that we're planning to do. So the event tab is also helpful. Okay.
You know, I just had one more thought, Kristen, just based on Rhonda's comment that if you have, you know, no problems with vaccine access or clinic partners, that's great. But if you want to just know if we're aware of anyone in your area, you can also feel free to reach out to us this week and we can look it up pretty quickly for you.
Thanks, Megan. It's another great thing to think about also because, you know, a lot of our residents are going to be coming up for their second dose. They're 6 months apart generally, and we want to make sure that we have a plan, make sure that we're preparing ahead of time for that stuff as well. Okay, I'm going to go back to the slides. You guys will receive a copy of these slides and it has links to some of these, but again, you can also just go to the Telligen QI Connect homepage and navigate to each of these sections as I showed you. Any final questions? Feel free to unmute, put them into chat. We have a few more upcoming sessions. So this Thursday is going to be the Power of Words, Communication Strategies for Uniting Staff for Infection Defense. Then Tuesday next week is going to be Hands-on Improvement, Performing Hand Hygiene Audit Data into Action Plans. Oh, sorry, Transforming Hand Hygiene Audit Data. And then next Thursday, we're going to have a session, kind of a special session, different session, and it's going to be where we've been and where we're going. Okay. And then here's how you reach us. So you can always reach out to us at the nursinghome@telligen.com email address. That one can be, it's kind of a triaged email box. So it'll be sent to whichever person it needs to go to. So that's kind of a general good one to reach out to us. And if there are no other questions, please have a wonderful day. We appreciate your time that you were on today. Thank you for looking at our resources that we have and offer to you. And please don't hesitate to reach out. And aside from all of the online resources, we are a resource. So don't hesitate to give us a call, give us an email, and we'll see what we can do for you. Thank you so much.